start us off, this webinar is being recorded, so we will send a recording out of this presentation after it is finished. So welcome to everybody that is already joining us and coming in, in the next couple of minutes. We are here for a webinar all about what you need to know about Medicare. My name is Katie Hendrickson. I am one of the sales counselors here at RiverWoods Manchester, but I am joined by Pat Bennett. So a little bit about this presentation. Everybody is on mute. So if you have any questions that you'd like answered at the end of the presentation, feel free to type them in at any point in the Q&A box. We will answer them in order. If you've already typed in your questions when you registered, we do have those ready. But anything you think of during the next hour, feel free to type them in. We welcome any suggestions on how to improve the webinar for next time. And if you have a topic of interest that you'd like to discuss at a future event, let us know. We would be happy to make something happen. So we are joined by Pat Bennett, but this webinar is hosted by RiverWoods. So a little bit about our communities. We have 3 communities: Exeter, Manchester, and Durham. Exeter was our very first community starting in 1994. It started out as 1 building, but has since grown to 3, the Woods, Ridge, and Boulders campus. Manchester was our next community. It started out as a Women's Aid and Relief Society, then was just a nursing home and became a full continuing care retirement community over the years. It's been under RiverWoods supervision, if you will, for the past 6 years, and made the official name change to RiverWoods Manchester about a year ago. And then our newest community is RiverWoods Durham. So that's about 3 to 4 years old. So if you have any questions about any of these communities, feel free to give myself or my coworker Jen a call so that we can help answer any questions you have. But enough about RiverWoods. We are here with Pat Bennett. She is a certified long-term care counselor, and she is the founder and president of Longevity Planning. This is located in Portsmouth, New Hampshire, and she has over 30 years of experience advising people on long-term care planning and all of the insurance-related questions that people may have. So without further ado, I will pass this along to Pat, and feel free to take it in which direction you'd like.
Okay, thank you, Katie. And thank all of you for being here today. I really appreciate you taking the time to learn a little bit more or explore more about Medicare. Some of you may already be on Medicare and have been on it for a number of years. Some of you may be still working, say past age 65, and you haven't yet transitioned onto Medicare. So you have questions, and as Katie mentioned, we do ask that you put them in the chat box. I will address as much as I can at the end, but I'm going to start with the kind of the most basic basic of the basics, as I like to say, is what is Medicare? It is a national health program for people who are over the age of 65. That's what it is primarily for. It's administered by CMS. You'll hear me refer to CMS as as the presentation goes on, but that refers to the Centers for Medicare and Medicaid. But the enrollment for Medicare is done through the Social Security Administration. So who is eligible for Medicare? Well, everyone over the age of 65 that's a U.S. citizen, as well as legal residents who have lived in the United States continuously for at least 5 years. And then some people are eligible if they're under age 65 by reason of having a disability. People will often say to me, they'll say, Pat, what is with all these letters, the ABCs of Medicare, as we like to call it? So many different parts, and it gets very confusing and overwhelming, but I'm going to break it down into 2 sections today: things that are provided by Medicare, and then things that are provided by a private insurer that has a contract with Medicare. So the part A is primarily hospitalization. It does cover a little bit of skilled nursing care, some hospice care, things like that. Part B is primarily medical expenses. So going to the doctor, diagnostic tests, labs, x-rays, things of that nature. So those are the two pieces that are provided by Medicare. Then there's a Part C, also known as a Medicare Advantage plan. And this is a type of plan that is provided, offered by a private insurance company. But it is, there's a number of different Advantage plans that are offered in this area. And these are policies, plans that have a contract with the federal government. And basically what happens is this is an alternative to the original Medicare route that we'll see in just a minute. And then Part D is the only letter that makes any sense. Just think D for drugs. That's your prescription plan. So these are the four basic parts of Medicare. And as I said, we'll be breaking these down a little bit further. For anyone that's on Medicare, every year you receive a booklet called The Guide to Medicare and You. All right. And it comes in the mail, or if you have signed up to receive it electronically, you can go into your Medicare.gov account and you can see this booklet. But from this booklet, you'll see that there's two ways that they describe that you can have your Medicare. The first one, what we call the original Medicare route, is where you have your Part A and B. And then if you'd like, you can add a prescription drug plan. And you can also add what is called a Medigap or a Medicare supplement policy. Medigap and Medicare supplement refer to the same thing. Okay? Two words talking about the exact same thing. Who says Medicare is confusing? But what a Medicare supplement plan does is it helps you pay for some of the deductibles and coinsurances that you would have if you just had your Part A and B of Medicare. Because those two pieces do not pay for all of your expenses. So if you go the original Medicare route, oftentimes you will purchase what's called a Medicare supplement plan to go along with that. As I said earlier, the other way that you can have your Medicare is to go with what we call option 2, which is Medicare, which is a Medicare Advantage plan, also known as a Part C. And those types of policies include the benefits of Part A and B of Medicare, as well as oftentimes they include prescription drug coverage. And there may be also some additional benefits that those types of plans include. But first, I want to talk about Medicare enrollment. For those of you who have not yet enrolled in Medicare, this is a very important piece to consider because oftentimes it's a little confusing, especially if you work after age 65, as to when you should enroll in Medicare. There's a basic principle of enrollment that unless you're covered by an employer plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. And the coverage has to be based on your current employment of that of you or your spouse. So for example, if you're on COBRA with a company that has over 20 employees, that doesn't count. It has to be based on your current employment. Okay. So that's when you would enroll in Medicare. But what if you don't enroll in Medicare on time? You may end up paying a late enrollment penalty. And the longer you wait to enroll in Medicare, that penalty will increase. Also, your healthcare expenses might not be covered by other insurance. And also your private insurance limited options would be very significantly limited. So I just want to mention, how do you enroll in Medicare? If you're receiving Social Security, when you turn 65, your Part A and B are automatic. You can decline Part B if you don't want it, meaning if you're covered under a large group plan and you don't need it at that time, you can decline it. But if you are collecting Social Security, when you turn age 65, you will be automatically enrolled in Part A and B. And your coverage will start on the first of the month that you turn age 65. Part C and D, those are not automatic because, as I said, those are issued by private insurers. So you actually have to proactively enroll in those types of plans. If you're not collecting Social Security at age 65, you have to sign up through the Social Security Administration during a Medicare open enrollment period. And there's different enrollment periods. There's what we call the initial enrollment period. And there's also a special enrollment period. And then there's a general enrollment period. And we're going to learn a little bit more about those now. If you sign up during your initial enrollment period, and I do want to disclose that this is changing as of January 1st, but if you sign up during your initial enrollment period, and the initial enrollment period is not changing, it's the 3 months before, the month of, and the 3 months after you turn 65. So that's what is called your initial enrollment period. But what is changing for January 1st is when your coverage is effective. Most people will typically sign up the 3 months before they turn 65, and then the coverage is effective the month that you turn age 65. If you sign up the month you turn 65, then your coverage is effective the next month. And this is what's changing. If you sign up 1 month or 2 or 3 months after you turn 65, they're now going to make it so it's effective the next month. You won't have to wait 2 or 3 months as people do now. So for the balance of the year, this chart is correct, but then next year, you'll see a little bit of a change in that. Okay. And who signs up for Part A during the initial enrollment period? Almost everyone who turns 65 will sign up for Part A. However, you do want to check with your benefit administrator, meaning your human resources department, if you're still working and you're covered under a large group plan. So you may be advised that yes, you should enroll in Part A to increase the coverage that you have perhaps potentially for hospitalization. But you do not want to sign up for Part A of Medicare if you are covered under a health savings account. If you're contributing to a health savings account, your contributions have to stop upon enrolling in Medicare. So very important, if your group plan is a high deductible health plan and you have a health savings account associated with it, it's very important that you have a conversation with your benefit administrator as you approach 65 or as you contemplate retirement. So who signs up for Part B during the initial enrollment period? So this is basically folks who are not covered by an employer that covers more than 20 employees when they turn 65. So somebody who's not working would sign up, somebody who's self-employed or somebody who's employed by a small company, somebody that's on COBRA, and COBRA is the extension of your benefits that you get when you retire under age 65. You probably familiar, you can carry your health insurance for 18 months after leaving a company. So if you're on COBRA, you will want to sign up for Part B when you become eligible during your initial enrollment period. Somebody who's receiving retiree health benefits, you would want to talk to the sponsor of that plan to see whether you should or should not enroll in Medicare Part B. And then anyone who's employed by a company whose health plan is less comprehensive than Medicare. So, who signed up for Part D during the initial enrollment period? People who have signed up for Part A and B who are looking to have either prescription drug coverage either now or in the future. And sometimes people will say to me, well, Pat, I don't take any medications, so I don't think I need a drug plan. I'm not going to sign up for a prescription plan. Unfortunately, what happens is if you wait several years to sign up for a drug plan, when you start taking medications, number one, you can only get a drug plan during an open enrollment period. So if you suddenly had a significant change in health in February and you were not on a prescription plan, you may not be able to get a prescription plan until the next open enrollment, which runs October 15th to December 7th, and your coverage wouldn't begin until January. So that's one problem. The other problem is that you will pay a penalty of 1% per month over and above the national average plan for every month that you didn't enroll. And you don't pay that penalty just the first year that you decide to join a plan. You pay that penalty every year for the rest of your life. So, so think about that decision carefully. So, and again, you will not pay a penalty if you are covered under a group plan whose coverage is at least as good as or better than Medicare. That's what we call creditable coverage. And if you are covered under a group plan, you receive a letter every fall that indicates whether your group plan is creditable, meaning is it as good as or better than Medicare. And if it is, you don't have to worry about it and you don't have a penalty. So And as I mentioned earlier, there are two ways that you can get a prescription drug, a Part D plan. You can either have a standalone Part D drug plan, or you can have a Medicare Advantage plan that covers prescription drugs. So a special enrollment period. If you're one of the folks who is working past age 65 and you're covered by a larger group plan that's covers more than 20 employees, you can sign up. You have what's called a special enrollment period, and you can sign up for Medicare Part B at any time, any month before your coverage ends. So if you want to retire in May, you can go ahead and retire in May. It's not a problem. You don't have to wait till the fall or something like that. Because anytime you're covered under a group plan, you will have a special enrollment period for applying for Part B. You also have a grace period of 8 months after your coverage ends, but do not wait and use up that grace period. Because while the grace period is for 8 months for Part B of Medicare, it's only 63 days for Part D. And again, you have a special enrollment period for signing up for a prescription plan, but only with for 63 days, okay, if you wait until after your coverage ends. So the best time to enroll to avoid late enrollment penalties is to sign up during either your initial enrollment period, and again, that's that 7-month window around your 65th birthday, or during a special enrollment period, which is when you're covered under a group plan. That's the best way to avoid any penalties. And if you want to avoid any gaps in coverage, you really want to sign up before your current coverage ends. So if you missed all those things, you didn't know about the initial enrollment period, you didn't realize you had a special enrollment period, you were basically just hanging out there, not, paying attention to any of these things, and then you decide that you want to join Medicare. Well, at that point, you would only have one other opportunity, and that's during what we call a general enrollment period. So again, this is for somebody that did not sign up for Medicare when they first had opportunities to do so. That general enrollment period runs January through March, but your coverage does not begin until July 1st. So very important that you hopefully try to avoid this, because this is not good to have a number of months that are not covered. So, and this is why we always strongly suggest that people who are over 65 do not go on COBRA and run that 18 months out, because when your COBRA ends, when you're on month 19, that is not a special enrollment period. And if your COBRA ended, say, in October, you would have to wait until January, February, or March to sign up for Medicare, and it would not begin until July 1st. It's a very big problem that very few people face, but when they do, it's fairly significant. Okay, so again, just a review of the enrollment periods. Initial enrollment period, when you're turning age 65, special enrollment period for people who are working, covered under a group plan of more than 20 employees, and best time to sign up is before coverage end, and then general enrollment period for people who didn't take advantage of one of the two other enrollment periods. So how do you sign up for Medicare? Luckily, this is very easy. If you're new to Medicare, meaning you're turning 65, you can go on the socialsecurity.gov website, which is seen here, ssa.gov, and there's a big button that says click on Medicare, and then it says apply for Medicare benefits. And you can apply for Medicare benefits and then not apply for Social Security. The two are not connected, meaning you could collect Social Security at 62, but your Medicare wouldn't start until 65. Likewise, you could sign up for Medicare at 65 and defer your Social Security payments until your full retirement age, or even age 70. So even though it's administered through Social Security, and that's where you sign up, they're not tied together. The other thing that you can do is call Social Security at 1-800-772-1213, and they can also help you with your enrollment. So how to sign up for Medicare Part D. First, you decide whether you want to go the original Medicare route, where you're going to have your A and your B and a prescription plan, and then also perhaps a Medicare supplement plan, or you're going to go on to a Medicare Advantage plan. So that's a decision you make, meaning you don't have a Medicare Advantage plan and a separate drug plan. Okay, those would cancel each other out. So you really want to be clear on which route you're going. So And a couple of different ways that you can apply for a drug plan is to go through a private insurer directly. You can also go to Medicare.gov or call 1-800-Medicare. And you will notice in the guide to Medicare that you receive, the one that says Medicare and You 2023, there are the different prescription plans that are available in your state that are listed there. And this is available right online for every state on the Medicare.gov website. However, you really want to use the tools that are available on the Medicare.gov site to shop and compare for plans. So, and we'll go over that in just a little bit. So Medicare and private insurance, how do they work together? There are out-of-pocket costs that are paid for by Medicare beneficiaries. Some of them are premiums, and some of them are things like deductibles. But the premiums, the Part B premiums, are paid to Medicare. And then you also may pay private insurance premiums for either your drug plan or your supplement or a Medicare Advantage plan. And then there also may be other out-of-pocket costs like deductibles or a portion of doctor's bills that are not paid by Medicare. And then there are also going to be services not covered by Medicare. So some of the monthly premiums. For most people, there's no cost for Part A. I don't like to say it's free because you certainly pay taxes for many years, all right? And actually you have to have paid into Social Security, either you or your spouse, for over 40 quarters, so 10 years, and your Part A will be a zero premium. If you have between 30 and 39 quarters of Social Security paid into the Social Security system, you would pay $274. And then if you have less than 30 quarters, you'll pay $499. And again, either you or your spouse work history will qualify you. The Part B premium for this year is $170.10 per month. In the coming weeks, all of the new information about next year's costs and next year's plans and so forth will be coming out. So again, we're just on the verge of kind of the open enrollment to Medicare, so you will see a lot more information as the weeks roll forward. But you may also pay an income-related adjustment amount, if applicable. And the next slide is going to discuss that. And then for the Part D, it does vary by the plan. And then plus there is that income-related monthly adjustment amount, also known as IRMA, okay? And I kid with people and say, if your Uncle Sam doesn't take it away, your Aunt Irma will. So just think of it as it's an additional charge, an additional cost that you will pay on a monthly basis if you are a higher income earner. And that's based on if your modified adjusted gross income is above $91,000 and you're single, or if your joint income is above $182,000. So let's say we had a couple who was in this category and they're making $200,000 per year. That's their modified adjusted gross income. Instead of paying the $170.10 per month, they will pay an additional $68 for that income-related adjustment amount. And then let's just say, for example, their Part D premium, their prescription drug plan is $40 a month. That's the average, the national average. And they would also pay an additional $12.40 on top of that Part D premium. So instead of paying $210 per month for all of those things, they would end up paying $290 per month. Now, this chart, as you will see in the Medicare and You booklet and on the Medicare website, is based on your income 2 years prior, meaning for 2022, they base it on what you earned in 2020. If, however, you've had a change in circumstances, such as reduced work hours, stopped working, divorce, death of a spouse, loss of income producing property, anything like that, you can file what's called a Form SSA 44, and you can get that adjusted. So it's not as though you have to pay a higher amount for 2 years after you stop working. But again, this is all customized to each individual, but you can look at the chart and see where you would be for these costs. And the new chart will be coming out in the next several weeks for next year. So some of the deductibles that you're responsible for. Under Part A, this year it's $1,556 per spell of illness. That's if you go into the hospital. Part B has a deductible, $233, but it is waived for many services like flu shots, preventative care, mammograms, bone density, things like that. And then the Part D deductible is $480, but many plans do waive that for generic drugs and whatnot, or they may offer a lower deductible than the $480. So you also have co-insurances that you were responsible for if you just had Part A and B of Medicare. So for example, the first 60 days was subject to that $1,556 deductible. But then when it comes to days 61 through 90 in the hospital, there's now a per day copay of $389. And then once you get to day 91 to 150, that doubles. And then also there's a copay for days 21 through 100 in a skilled nursing facility. Medicare may pay up to the first 20 days at 100%, assuming that you've had a 3 overnight hospital stay and you're receiving skilled care. They would cover the first 20 days, but then days 21 through 100, you would then be responsible for that $194.50. And again, these are all things that you could potentially have covered if you choose to purchase a Medicare supplement plan. So, Part B, if your doctor accepts Medicare assignment, then you would have a 20% patient responsibility for Part B services. Again, this could be covered by a Medicare supplement. If your doctor chooses not to accept Medicare assignment, they could charge up to an extra 15% over and above what Medicare considers the usual and customary charge. And then you would be responsible for that. And you can go to the Medicare.gov website, and right on the homepage, there's a thing that says find a doctor or find a provider. You can click on that, type in your doctor's name, and you can determine whether or not they accept Medicare assignment. Part D coinsurance, again, there is a deductible of the $480 for this year, and then you have to pay 20% of the cost, 25% of the cost after the deductible is met. And then you pay a small copayment once your out-of-pocket spending has reached $7,050. But drug plans do vary quite widely. Some will pay much more than these benefits. This is what we call the standard plan design, meaning they have to offer this level of coverage or better. And what's very important is that you need to find a plan that covers the drugs, the prescriptions that you take. And you can do this very easily by going to the Medicare.gov website. And if you're on Medicare, you can create a username and a password for yourself. You can put in your prescription drugs and they're saved there. And then put in your preferred pharmacy. You can put up to 5 pharmacies at a time. And the program will help sort those plans by what's going to be the least expensive overall for you. And I always want to stress that. Don't be concerned that everyone you know, even your spouse probably, is going to be on a different drug plan than you are. And it doesn't have to necessarily be the same drug plan that you have your Medicare supplement with. It's based on your drugs. Every company has what's called a formulary. That's the list of covered drugs. And they will have different copay amounts and different things like that based on the medications that you're taking. That you are taking. I do want to make a comment about the new Inflation Reduction Act that was just very recently passed. The Guide to Medicare and U-Books for 2023 came out before that was passed. So you will be receiving updates in the mail and via email, and you can also see them on the Medicare.gov website about how the drug benefits are changing and how your costs are going to be going down in this area over the coming years, which is great. Many very exciting changes that are coming in play in the next couple of months, the next couple of years, and you will get more details on that in the next month. So watch in October, November, December, you'll see new announcements that are coming out as these benefits roll into effect, but also know that some of the things that were passed may not actually go into effect until 2024 or 2025. Okay, so back to what Medicare covers. Hospitalization, the first 60 days, medical services, they cover 80% of Medicare approved amounts, and they also cover some preventative services. And again, the Medicare and You booklet or on the Medicare.gov website, you can see a complete list of those services. It's kind of funny that Medicare in their booklet spends 20 pages explaining what Medicare does cover, but only one page that covers, that mentions what they do not cover. And I want to just spend a few moments on this and just mention that long-term care is not covered other than that 100 days of skilled nursing care in a hospital following a post-hospital stay of 3 days or longer. They also do cover a very small amount of skilled care in the home. But other than that, extended long-term care, either in a assisted living community, nursing home, adult day out programs are not covered, and an extended home care is not covered. If somebody just needed help with house clean, basics activities of daily living, getting in and out of the shower safely, dressing, preparing your meals, house cleaning, grocery shopping, those things are not covered under your regular Medicare and your Medicare supplement. Also, Medicare does not cover care that is delivered outside of the United States. People are oftentimes very surprised by that. And again, it's in the Guide to Medicare, but sometimes people don't read every page in the Guide to Medicare. And this is very easily remedied. You can purchase either a short-term policy, the travel policy that will cover you for a period of time that you're outside of the United States. And it may be in the $8, $9 a day type range. And you can just buy those plans for the days that you're gone. Or if you're going to be doing quite a bit of traveling after age 65, and when you're on Medicare, you may want to consider a year-long policy. But very important to remember that Medicare does not pay if you are sick or injured outside of the United States. And I go so far as to tell my clients, put an orange piece of paper in every one of your suitcases or something that says get foreign travel policy. That way, if you're taking a last minute trip up to Canada, or one of the kids get hurt in Costa Rica and you're on the next plane out of Boston, when you go to pack that suitcase, at least you'll remember, I've got to get a travel policy. Okay. Dental care, routine dental care is typically not covered under Medicare at all. It may be covered as a extra benefit under a Medicare Advantage plan. Same thing with vision care, routine vision care, hearing aids, cosmetic surgery. So some things we can, forego if we needed to, but acupuncture and other alternative care, that is changing though. There's some new benefits available for that. And then amounts over the Medicare approved amounts, and then amounts not covered by deductibles and coinsurance. So again, it's very important to pay attention to what Medicare does cover, but it's also equally important to pay attention to what they do not cover. So what private insurance may cover, either in full or in part, is the Part A deductible, the hospital cost after 60 days, the 20% of the doctor bills, and then also the amounts above what Medicare allows, what we call the Part B excess charges. Your Medicare supplement may cover that. You also may have coverage for foreign travel on a Medicare supplement. But again, it's very important to look at any limitations that will have. As far as prescription drugs, the deductible may be covered. And then also most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period, but not in the donut hole. And again, we'll be going over that. That's going to be changing as the years go along. Okay. So Medigap policies, just touch on a couple things with this, is that these are private health insurance plans for individuals. They're sold by private insurance companies. They supplement original Medicare, so your benefits under Part A and B, and they follow federal and state laws that protect you as the consumer. And they are standardized. I often get a question whether the Medicare supplement plans are the same in every state. And unfortunately, my answer is most states, except for Massachusetts. And I know we have many people here from on the call today, but Minnesota and Wisconsin, they have different standardization. Like in Massachusetts, a popular Medicare supplement plan it's called Medicare Supplement Plan 1A. Whereas in New Hampshire, Connecticut, Rhode Island, Maine, that same similar plan is called Plan G. So, but again, it's important to know what your coverage is in your state, what's available in your state. And then also, if you're anticipating a move to another state, you want to look at how your plan will change, and will it change? Would you need to make a change in that plan? So very important when you're starting to anticipate a move. And again, if you have a Medigap policy or a Medicare supplement plan, you don't need a Medicare Advantage plan. These are alternatives. You're going to do one or the other. And you do pay a monthly premium for this, and then costs do vary by plan, company, and location. So again, it's important to shop and compare. Medicare Advantage plans. These are health plans that are approved by Medicare. They're also called Medicare Part C plans. They are run by private insurance companies. And what happens is Medicare pays an amount for each member on a monthly basis. Many of them, you may have to use a certain network of hospitals or doctors. And they may also include prescription drug coverage. And they may also include extra things like discounts on hearing aids, vision, dental. But every plan is going to be slightly different. So it's important to look at what's important to you. And I don't recommend that you just look at the guide to Medicare and You 2023. And in the back of the book, it lists all the Medicare Advantage plans, and it gives just very basic overview highlights. You need to dig a little deeper, and you can do that either working through, with an insurance broker, or you can also do some research online on the Medicare.gov website. That's a great website that's been out now almost 20 years. And it's really, I've seen it improve almost, every year. And it's for you to use as a resource to be able to shop and compare plans and find if your doctors are covered under a certain plan, and getting into more specifics, much more than just a general overview. So, Medigap policies are standardized, but premiums do vary considerably. You want to choose a policy that makes, the most sense for you. You want to look at a reputable company that's offering the lower price, and then make sure your healthcare provider processes the billing for the company that you choose. And drug plan, same thing. Plans vary considerably, but use the tools that are available for you, especially the Medicare.gov website. That really, if you haven't used it before, please do take a look at it. It's a great tool to be able to shop and compare plans. And again, Medicare Advantage plans also vary considerably, and you want to choose a plan that offers the coverage that you need and also covers the medications that you take. So there's a number of factors that go into effect when you're looking at comparing plans. So just a couple final thoughts on healthcare costs in retirement. Your retirement budget, unfortunately, all of our budgets have been changing over the last year or two with what's happening in the economy, but certainly, rising healthcare costs do lead to higher insurance premiums, higher out-of-pocket costs for things that aren't covered. And then you may also incur some additional things like dental, vision, hearing, alternative type care. Long-term care is something that could certainly adjust what you pay out of pocket. And these are just some scary numbers on what it costs for future healthcare costs and what you should try to plan for. Fidelity indicates that it's about $300,000 for a couple to pay for things throughout your retirement and future medical costs, not taking into account long-term care. That's separate. And the Employee Benefit Research Institute, basically says $142,000 for men, $149,000 for women, and about $296 for couples. So again, very similar to Fidelity. But what's important is to look at your own customized analysis, whether you're 6 months from retirement or 5 years from retirement and coming off of a group plan. Now is a good time to start taking a look at what those costs will look like. So that way you can plan for it and budget it. And again, there's many different plans at various different price points. So planning for long-term care, as I've mentioned, long-term care is not covered by Medicare or Medigap policy. It does only cover skilled nursing care, no coverage after 100 days. The average is 28 days because oftentimes you don't need that high level of care, what we call skilled care. You might just need, help with what we call the activities of daily living, getting dressed, preparing your meals, things like that, doing your showering and whatnot. So again, Medicare supplements, Medicare Advantage plans, they're not designed to pay for long-term care. So starting to have some of those conversations with your family is really important if you haven't done so, because unfortunately, and these are average costs throughout the country, and we do have people represented on the meeting today, all throughout the country, is that, but again, they're very costly. And it's something that you do need to start thinking about and talking about. And that's why it's great that there's some places that you can do some research on that. So you can spare your family the burden of caring for you, avoid having to spend on assets to go onto Medicaid. And unfortunately, you do go that route, you do have more limited choices as to where care can be provided. And then also by having a plan for long-term care, you can direct your care, you can stay as independent as possible and receive the kind and the quality of care that you want. So 3 last reminders I just want to mention about Medicare is number 1, make sure you're enrolling in Medicare on time. And this is very individualized. I can't stress this enough. I don't want you to say, oh, my friend Joe enrolled in Medicare Part A and B, so I should also, or he didn't, so I don't need to. You really need to be in touch with the Social Security Administration, talk to your HR department, and see what makes the most sense for you and enroll on time. Number 2, shop carefully for private insurance. There are many differences. And use the tools that are available for you, such as the Medicare.gov website, as I mentioned. And one thing that I do want to mention is that for people who are on Medicare, every year you have what's called an open enrollment period where you can change your prescription drug plan from one company to another. You also have periods of time when you can change your Medicare Advantage plan. You can do that during the Medicare open enrollment period, which runs October 15th to December 7th. That's the same time you can change your drug plan. And then you also can do that in January through March. But I would say most importantly is start looking October 1st, which is coming up this Saturday. You will be able to see the plans and the changes in your plan for next year. For anybody that is on Medicare right now that has a prescription drug plan or a Medicare Advantage plan, you would have received what's called an annual notice of changes. That comes to you in September. Sometimes you just look at the premium and say, oh, it went up $1 or $2, or it went down or whatever, and you don't even look further into the package. It's important to check and make sure your medications are still covered. It didn't go from one tier to another or something like that. The other thing that, as I said, you can do when we're in what's called the quiet period, starting October 1st to October 15th is when you can actually go on the Medicare.gov website, see all the changes, evaluate the plans, put in your prescriptions and whatnot. And then October 15th to December 7th is when you can actually make changes to your plan. So again, shop carefully, use the tools that are available to you, reach out to somebody, such as myself, as a broker. There's no additional cost for working with a broker. But again, it's very important not to just have your Medicare be a set it and forget it sort of thing. It's very important to look at your benefits each year and see how they may or may not be changing. And then last, plan for higher healthcare costs in retirement. And just really look at, what those costs might be, how might you pay for them, what policies or options do you have, and then research that. So again, I'm just encouraging you to take this information that I've shared with you today. I wish I could say that I was going to share very specific information about what's coming and what's changing, but we do have to wait until October 1st till much of that is released, so I can't mention that today. But do watch both your mail notices coming from CMS, the Centers for Medicare and Medicaid, as well as on the Medicare.gov website. They will be putting up information as more pieces of the Inflation Protection Act rolls in and whatnot, and starts to really benefit consumers. But it is a very exciting year for Medicare. It really is. And I just hope you take that opportunity during that October 15th to December 7th to just shop and compare for your plans. So now I'm going to turn it over to Katie, who is going to mention the new program coming up and open it up for questions.
Absolutely. So a big thank you to Pat for doing this presentation. It was wonderful. Definitely a lot of really useful information to take with us. But yes, so we are open for questions now. So if you'd like to type in anything that you'd like answered into the Q&A box, which is either at the bottom or top of your screen, depending on if you're using a computer or a tablet or phone, feel free to do so now. We do have a next webinar coming up on October 26th. It is all about, navigating retirement as a single adult. So if you'd like to join us for more information regarding that event, we have a QR code right on your screen. If you have a smartphone, feel free to just open your camera app and hold it up to the screen, and it should give you an automatic link to register for this. Otherwise, my coworker Kim has put the direct link into the chat box. You can feel free to register that way as well. So it does look like a handful of people have already written questions along the way. So just given our time, we can start into that. Any question that we don't get to, we have recorded, so we will be following up, but we will try and answer as many as possible because there does seem to be quite a few. So let's see. The first question we have is, do those companies that advertise on TV about Medicare supplement plans provide a significant advantage to go through them? And supplement plans and advantage plans are two totally different things, correct?
Yes, that is correct. And unfortunately, we're all bombarded with commercials during open enrollment to Medicare. And those plans are just one of many different plans that you could choose from. In many areas, you may have, for example, 37 different Medicare Advantage plans that you could choose from. I recommend that you use the tools available to you on the Medicare.gov website and or talk to a licensed broker in your area that can help you compare plans. So, and some of the plans, I do want to mention that some of the plans that are mentioned is and some of the benefits that they offer are only available to certain lower income beneficiaries, perhaps people who are eligible both for Medicare and Medicaid. So if you're wondering, my plan doesn't give money towards groceries or whatnot, that is likely the reason. So, okay.
All right. So next question asks, I am on SSA survivor benefits. Is that considered being on SSA, or do I need to be on my own record? I ask because you said when a person is on SSA, they automatically get signed up for Part A and B.
Yes, you will. And I hate to say this, but you will most likely get automatically enrolled in Medicare at age 65. However, I would encourage you to call the 1-800 number for Social Security, which is the 1-800-772-1213, and they will be able to very specifically answer that question for you. So.
Great. So then we have, I was told that I could not contribute to an HSA after 65, whether or not I enrolled in Medicare. That was 5 years ago. Did this change?
That did not change. You can't have, the way the rules are now is that you can't have any part of Medicare and contribute to a health savings account. Also, you can't contribute to, because if you're not enrolled in Part A, let's say somebody was 68 years old or 70 years old, and you decide you're going to enroll in Part A today and Part B, what's going to happen is they make your Part A application effective date 6 months prior. So you actually can't contribute to a health savings account 6 months before going on to any part of Medicare. But I do recommend that you reach out to your HR, not only your HR department at your employer, but also the benefit administrator that administers the HSA plan, because there has been some pending potential legislation and what have you relating to HSAs because of all the number of people who during COVID were laid off and didn't know 6 months in ahead that they should have stopped contributing to their HSA and so forth. So to my knowledge, nothing has specifically been passed regarding that, but I would recommend that you reach out to your HR department to get the most up-to-date information about that.
Okay, thank you. Next, we have Medicare A and B and a creditable supplemental plan via my former employer. Our prescription drug benefit under the supplemental plan is capped and will be used up within the next year or two. How best to find a prescription drug plan for when prescriptions are no longer covered by our current supplemental plan?
Great. Okay. That again is going to the Medicare.gov website. And again, anyone that is on Medicare, you can create your own username and password. You enter in your prescription medications, you pick your preferred pharmacies, and the program will put all, however many plans there are in your area, but let's just say 21 drug plans in descending order from the least expensive overall, which includes the cost of the plan plus the copays that you'll pay at the pharmacy. But you'll find the one that's going to work the most efficiently for you is, put them in descending order. That's the best tool to use.
Awesome. Next question is the Part B monthly premium of $170.10 per household or per person?
Sadly, it is per person. So, yep, that is a per person amount. But I do want to point out, and I didn't get a chance to mention this earlier, if anyone is of low income or you have a family member that you're working with that is of a lower income, please reach out to either your local area agency on aging, depending on the state that you live in. Here in New Hampshire, we have an aging and disability resource center called ServiceLink, and they can do an assessment to determine whether you might qualify for any extra help paying for your Part B premium. But again, there's programs like that in every state, so please reach out.
Next question we have is, can you change Part D if your prescription needs change?
Yes, yeah. Every drug plan covers drugs in every category of things that could happen to you. So it's not as though you would suddenly become diabetic in May and we would say, oh gosh, that's too bad, you're not covered for that. You're certainly covered for diabetes medication or what have you, but come open enrollment time, you're going to want to put in not only the medications you had been taking plus your new medications, and then figure out what's going to be best for you for the coming year. And you can change during that open enrollment period. Now, when I say that every drug plan covers drugs in every category, that's not to say they cover every drug. Meaning your doctor might prescribe purple polka dots, but you need to take green, but your plan only covers green polka dots. The other thing that could happen is that your drug plan could grant what is called a formulary exception, saying they'll cover purple polka dots till the end of the year, but then after that, you've got to go away and go on to a different plan. So, but again, that's called a formulary exception, and you would work with your pharmacist and your doctor to make that happen. So.
Great. Next one is, I was told that once I am on Social Security, my monthly cost increase for Medicare is not going to go up any more than my SSA increase in any year. That is, if my SSA increase for a year is only increased by $1 per month, then my Medicare monthly increase will only go up by $1 a month, even if the Medicare cost is increased by, say, $5. Is that true? It might inform me as to when I want to sign up for SSA before my FRA or not.
Okay. I would suggest that you go to the Medicare.gov website and put in premium increases for Part B. And there is some changes to that. I don't know if that's been loaded up into the Medicare.gov website. And if not, check back in maybe a month or so, because those things are going to be changing somewhat. So, okay.
Great, thank you.
And sorry to be so vague, but we're in a period of flux right now. So good.
Will Medicare.gov have the latest updates on new things just passed?
Yes. They will have it on the Medicare.gov website. It may not be immediate, so continuously check back. When you do go to the Medicare.gov website, you can sign up for email reminder or email notices so that when they do post something new or they come out with new regulations, you can do that. You can also check with your local senior organizations like AARP, for example, has an awful lot of information on their site, and they also have a state specific sheet for different information, so that might be a good source to check.
Thank you. Next question is, how do I understand coverage in a CCRC, which is continuing care retirement community, interacting with Medicare AB/Advantage?
Okay. Do you want to take that one, or you want me to take that one?
Sure. My answer would be give us a call. The specific CCRC that you're looking at may differ. So give your representatives for the CCRC you're looking at. For Manchester, this could be myself or my coworker, Jen Torgerson, and we can talk to you all about how this interacts at your specific community.
Yeah. And I do want to also just mention is that you typically do still always need a plan for hospital and doctor, even whether you're living in a CCRC or you're living at home or you're living in an assisted living community. You still have a need for having a medical plan that's going to pay for what we call acute care, something that has a beginning or an end, like surgery, going to the doctor, things like that, as opposed to long-term care, which is what you would receive in a CCRC.
Absolutely. And so for RiverWoods Manchester specifically, everyone coming in keeps Medicare A, B, and a supplemental.
Yep.
So one person notes that they are hearing that the per day prices are between $300 and $500 per day.
For probably referring to skilled nursing care. So yes, it does vary by state. If you're looking to see what the costs of care are in your area, whether it's home care, assisted living, or nursing care, Genworth does a study every year. So if you just Google Genworth cost of care, they're kind of the central location that most places will use to get current numbers in your particular zip code. You can put in your zip code, and then you can also increase it by 10 years out, 20 years out, and so forth, because it does vary considerably throughout the country.
One person asks, when you say that Medicare pays for 28 days of skilled nursing, is that 28 days total for your life or 28 days per incident?
That was an average of how long people will be on receiving skilled care. And again, skilled care has nothing to do with how sick you are. It has to do with the level of skill of the person performing the service. So it's things like speech therapy, physical therapy, inserting an IV, that high level of care. Somebody might have a stroke and they might be entitled to a potential benefit of that 100 days, and that is per benefit period. So if you're out of the facility for 2 months, then you potentially could have another 100 days. But you have to meet the 3 overnight hospital stay requirement, and you have to be getting skilled care. For a period of time following a stroke, they're going to be doing the speech therapy, physical therapy, things like that. But then your care might level off where you just need help getting in and out of the shower, getting dressed, preparing your meals. And then Medicare doesn't pay for that. That's considered custodial care. So that's where that 28 days comes from. It's just an average of how long people need that higher level of skill.
Thank you. One person says, Medicare said they would not approve a surgery prior to the surgery. How do we plan ahead? I had it at a cheaper hotel because I didn't know if I would be paying the total amount. My supplemental insurance said they would pay if Medicare paid.
Cheaper hospital? I think they probably meant hospital. Okay. You can call Medicare and give them the exact, the codes of what you're going to be having, and they can give you a better indication of, what they will pay. And your supplement is, again, is federally standardized. So if you're on Plan G, depending on what your expenses are and whatnot, you have the Part B deductible of $233. And between your Medicare and your Medicare supplement, it would be covered. But if you're on Plan N, you may have that extra charge. But again, you can call 1-800-Medicare and they can give you more advice on that. So.
Right. So just in paying attention to the time, I think that we are going to answer the questions that are specifically for you, Pat. And then any question related to CCRCs or RiverWoods, we will be following up with you to help answer. So just so that we're not running too much over. So next question is what to do for Part D if you are not using any prescriptions.
In that case, I do encourage you to go to the Medicare.gov website and just put in some pretend prescriptions so you see how it works and you see how the plans differ. You can also determine which plan might have your particular pharmacy that you like as a preferred pharmacy. But in that case, what many people will do is they will just sign up for the lowest monthly premium plan, knowing that that's going to cover a wide array of different medications that they take, and they could, if they needed to at a later date, change it to a different plan. So, but again, if you don't take any medications, and I'll just use New Hampshire as an example, you may go on a plan that might be maybe $8 a month instead of that national average of $40 a month. And again, as opposed to going on a more expensive plan.
Great, thank you. So next person said, what is the contact number to reach you? So I know this was on one of the first slides. So if you wouldn't mind.
Yeah. Again, my name is Pat Bennett and the company is Longevity Planning. And my number is 603-427-0101.
So next question is similar to the previous one. If I go on Medicare.com now, will it stay there so I can check it against the changes on October 1st?
If you go there now and you create your own account, meaning if you have a Medicare, you have to have a Medicare number, at least Part A of Medicare, in order to create a username and a password. But yes, if you go there now, put in your medications and update everything, then yes, come October 1st, you can go in and you'll see the changes.
Someone asked, how do I work with a broker?
You would, again, find a broker in your local area, and you would just reach out to them and see whether they're seeing people in person, by phone call, by a Zoom. The last couple of years, we've all been learning an awful lot about Zoom, and many of our calls are then done that way at this time. But as I said, there's no additional cost for working with a broker, and then you would just meet with them and share with them, what your situation, your particular situation is, and then we share with you what the options might be. But I do like to stress that myself and most brokers and most places, referring to like the television commercials and whatnot, we don't represent every plan in a certain area. And if you want to find out about all the plans in your area, you can call 1-800-Medicare or go to the Medicare.gov website. But
thank you. Do you know if the 5-year residency requirement applies only to legal residents, or can undocumented persons also apply for Medicare if they can prove 5 years residency in the US?
That is an excellent question that I do not know the answer of. I would suggest that you reach out to your to the Social Security Administration, and or your local area agency on aging, and they can help address that with you.
Right. This is phrased traditional Medicare in jeopardy versus Medicare Advantage.
No, traditional Medicare is not in jeopardy. It offers great options for people who are looking to have a plan where there are no networks of doctors, that you can go to any doctor that you choose, as long as they take Medicare. For somebody that maybe is interested in paying a little bit higher monthly premium, but having more predictable costs and lower expenses. But Medicare Advantage plans are certainly gaining in popularity. But I think we'll always have a two-type system, because again, there's every client has different needs and different price points that are affordable and reasonable to them. So, yep.
Great. The last one that's in the Q&A box says, my husband is turning 65 on 8/2023 and plans to continue to work for 2 or more years for a more than 20 employee company. My understanding is that he does not have to sign up for Medicare until he stops working. Also, I am 4 years younger than him, so will not be eligible for Medicare for 4 additional years. Can I use his COBRA even if he begins Medicare?
Yes. And again, with him working for a company over 20 employees, he'll want to reach out to them sometime. If he turns in August, I would say start asking questions around about April, May timeframe as to whether he should or should not sign up for Part A, because again, if he is not contributing to an HSA, adding Part A could enhance the benefits that he has for hospitalization. But if he is contributing to an HSA, he's not going to want to sign up for Part A of Medicare. Regarding your health insurance, you will have a number of different options. One is when he does go to retire, and let's say he goes on to Medicare Part A in August of next year, but then works for another year and then retires. Because you're under age 65 and your spouse is over age 65, you can then stay on COBRA instead of the normal 18 months. You can stay on COBRA for 36 months. So that's one option, that you can continue his plan, but just pay the COBRA premium for yourself and or your dependent children if you still have any, at home that are under age 26. The other thing that you can do, and I would suggest you start doing now, is to start going to the healthcare.gov website, very similar to Medicare.gov, but it's for people under age 65, healthcare.gov. Put in your zip code, put in your demographics of what you think it'll be when you retire, meaning your income and whatnot when he's retired, and then you will see whether you would qualify for any subsidies, which is, premium discounts towards your health insurance. And then also what those health insurance premiums will look like for you. There's quite a bit of information out there so you can shop and compare as opposed to just relying on your benefits under COBRA. So COBRA may be your best option, but do take a look at under the ACA plans, which again, you find out information about on healthcare.gov. And you can also call their 1-800 number and they can ask you a number of questions and then show you some different options as well. But that's the research to start doing now. So, okay.
Great, thank you. So the only remaining thing were some people send in questions ahead of time. Were there any questions that you wanted to address that we didn't touch upon, or any remaining thoughts that you'd like to voice?
No, the only other thought is just, again, please take the open enrollment to Medicare each year seriously. When you start seeing all those commercials on television, just remember there's something you're supposed to do, and go to that Medicare.gov website, check out plans. It's really important to talk to different people and get people's opinions, but keep in mind all your choices are individualized, and reach out to a broker so that way we can help guide you through that process. And whether you're transitioning onto Medicare or already on Medicare, it's just a good time of year to get a checkup and look at your plans. So it's time well spent. All right. And thank you all for your time today. And thank you, Katie, for having me here.
Absolutely. I was just about to say the same thing. A huge, huge thank you to Pat Bennett for this presentation. You did a wonderful job. Just for everybody that's still on the webinar, we will have a recording of this being sent out. So if you know anybody that registered but wasn't able to attend due to a conflict, they will be getting a copy of this recording. So thank you again. And if you'd like to sign up for our next webinar, it's on your screen. Otherwise, if you have any questions related to RiverWoods, feel free to give us a call and we'll help answer your questions accordingly. Thank you again, and we'll see you at the next event.